Good morning, everyone. There's a lot of you registered here this morning, so we're going to give it just a minute for everyone to pop on, but you're in the right place. Good morning. I see everyone trickling on here for our event this morning. We're going to get started in just a minute as we wait for folks to join. Thank you. Good morning, everyone. Thank you for joining us. I know there are those that are continue to hop on here. It's 10:01. We're going to get started in just 1 or 2 minutes. If you would benefit from closed captioning, please look at the bottom of your Zoom screen. We have closed captioning services available for you if that's helpful. Otherwise, we'll get started in just a minute. Okay, welcome everyone. I think there are going to continue to be some folks joining us here this morning, but I wanted to get on, introduce myself, and take care of some housekeeping reminders. Again, good morning. My name is Lynanne Gutierrez. I am the Assistant Director at Groundwork Ohio. We're really glad you've joined us today. All participants are muted, so we can't hear you. We hope that you can hear us. We encourage you to make comments and ask questions and say hello to us in the chat box. When you use the chat feature, all the panelists will be able to see your chat, but you won't be able to chat with each other during the webinar. We have a full agenda today, so if we can't get to your request or question during the event, we will follow up after the event if you provide your email address with the questions. I mentioned that there is closed captioning services. You can use that feature in the bottom of your Zoom screen if that is helpful to you. And please know that all participants will get a recording of the event and any of the materials that are shared today during the presentation. They can also be viewed at www.groundworkohio.org/familyvoice. So I'm just going to do a quick agenda overview and then hand it over to Shannon Jones, who's the president of Groundwork Ohio. We are really glad and really enthusiastic for everyone being online this morning to welcome and release our report, Amplifying Family Voice to Advance Equitable Outcomes for Young Children. Today we want to provide certainly a welcome and introduction to the Center for Family Voice at Groundwork Ohio from our executive director, Shannon Jones. She's also going to share how we completed our environmental scan and who we worked alongside to get here. And then it's back to me for the official report release and presentation or summary of the report. And perhaps the most important of which is knowing what to expect from the Center for Family Voice at Groundwork Ohio in the future. So then we will conclude with an expert panel discussion with state and national early childhood leaders. And so please, again, I see some more of you have joined. If you'd like to use closed captioning at the bottom of the screen, utilize the chat function to communicate with your panelists, and I'm going to hand it over to Shannon Jones.
Good morning, everyone. Thank you so much for joining us today. We are really excited about the launch of the Center for Family Voice. I'm Shannon Jones. I'm the president of Groundwork Ohio, and I'm thrilled to talk a little bit about why we set forth to do this important work. Many of you who've joined us today are familiar with the um, the work that we did back in 2018. We released the Ohio Early Childhood Race and Rural Equity Report. And in that report, we looked at 26 metrics along the life course of a child. And we looked at the data in a disaggregated way along race and in our rural Appalachian region, really wanting to understand where gaps emerged and where they existed, where they persisted, and where they continued to grow. Based on that work, we really were able to set a common language, change the conversation among policymakers, and really get them to start thinking about how important equity was as they were evaluating policy and investment. Then we took this report on the road and traveled all throughout the state of Ohio, wanting to share the data, but more importantly, really wanted to listen to how communities were responding to the data, collect their feedback, and that culminated in a second report that we released late last year. One of the findings from the report was the need that if we were really going to both integrate equity into our work at Groundwork, but also really move the dial in policymaking circles around equity, that families had to be front and center in this work. And so that really spurred our concept for the center. Once we had this concept, I had the opportunity in early January of 2021 to speak with Amy Cole, the president of Molina Healthcare in Ohio. And I'm really grateful for the fact that she bought into our concept, and she was as passionate as we were about how do we build up a center that ensures that families are a part of this process, both in informing programmatic, but also policy investments. And so through her strong support, we were able to get this work funded by the Molina Cares Accord. And so we're thankful for the belief that Amy had in us to do this work, but also with the Molina Cares Accord and their strong financial support of the center. We also, as we embarked on this next phase of the work, are really thrilled to have strong technical expertise that we were able to bring to this environmental scan that Lynn-Ann's going to talk to you about. We're grateful for the contributions of the Center for Healthcare Strategies, as well as the BUILD initiative. Their expertise really enhanced the work and helped us to inform how we think about the center and the theory of change as we move forward. And finally, it should be noted that this work wouldn't have been possible without the more than 40 interviews that we did with stakeholders all around the state of Ohio who were engaged in family and consumer voice activity, as well as national organizations who were involved in family voice work, to really understand how this work is sort of conceptualized and then operationalized to ensure that families are front and center. And so we thank you for being a part of this important process. So with that, I will now turn it back over to Lynn-Ann so that she can share with you the environmental scan, the theory of change, and all of the parts that are going to, really inform the development and the growth of the center moving forward. Lynn-Ann?
Thanks, Shannon, and certainly I share in the thanks to Melina, the Center for Healthcare Strategies, and Bill, and most importantly, the local community organizations that work with our Ohio families every day who are so generous with their time and knowledge, and we really look forward to supporting and elevating you through this work. We're excited to share this report to be a resource to those community organizations and certainly to the families across the state. And we hope that this work and this this report itself helps you all hold us accountable to our commitment to authentically engage family voice to inform and influence state policy. And to share with you our vision, we've created a short video, so we'll get that going for you guys right now.
We're excited to create the Center for Family Voice at Groundwork, Ohio, an initiative designed to ensure that families' experiences and their ideas inform how governments and communities support young children. We're dedicated to creating a center of excellence that authentically involves Ohio families in transforming policies to ensure more children are born healthy, meet important developmental milestones, and get the early learning and interventions they need. The goal is to be better at building the foundation that sets up children for success. We are passionately committed to equity, eliminating the entrenched disparities in systems that serve pregnant women, young children, and families. The center will be an authoritative resource for policymakers in Ohio and across the country who are committed to listening to families. We will empower families by increasing their advocacy skills, expanding their connections, and building their confidence. We will inspire stakeholders by demonstrating the impact of giving families the chance to co-create solutions, honoring family contributions, building inclusive cultures, and we will develop partnerships that value families' experiences. Finally, we will use these strategies to transform policy to improve outcomes for families and their young children. The Center for Family Voice. It's a place where families have a real say about how we support them.
Thanks, everyone. I hope you enjoyed that short video to help us share what are really big concepts here that we are implementing at Groundwork, Ohio. So the activity and leadership of the Center for Family Voice will spread or amplify influence to achieve its objective. And what you saw referenced in the video is what we're calling the amplification effect. And the amplification effect is a proposed theory of change to understand how the Center for Family Voice would advance policy transformation and improved outcomes for young children in Ohio. It's a working framework, and we're hoping to successfully demonstrate it here in Ohio, and it's going to continue to be reviewed and honed over time with all of your input. The Center for Family Voice will live at Groundwork, Ohio, and benefit from the skills and resources of our organization while also informing all of our organization's work. Groundwork will support all the core functions and activities of the center, and we believe based on our research that if we can invest in families and build and enhance their capacity and the capacity of local stakeholders to support them to engage families, including co-creating solutions for issues that deeply impact families' lives, and foster these partnerships, and foster then a partnership between families, local stakeholders, and Groundwork to connect them to statewide policy and advocacy, that we can spread or amplify the impact of these relationships and partnerships to transform state policy and improve and advance equitable outcomes for young children and their families. So first, before we continue on, I just want to define what family voice is or what family engagement is to us. And we've adopted a definition from the national organization, Family Voices. It is an authentic partnership between professionals and family leaders who reflect the diversity and the communities they represent, working together at the systems level to develop and implement better policies and practices. And again, when we consider the evidence base for the impact of family voice, we know that when families become more engaged, children, so their children, do better. And the impact doesn't just stop at the child or that family level. As parents engage with their own children, their confidence increases and their capacity to be effective advocates and parents increases. And it's this broader engagement that has this effect or amplification so that families have the capacity to engage with early childhood systems and actually impact systems change. So the Center for Family Voice hopes to build on this evidence base for supporting parents in becoming leaders and agents of change. And we know that while there are many good examples of family voice work in Ohio, it's uncommon for families to have a more than superficial influence or power when it comes to the care of themselves and their children in state early childhood systems. And we are really seeking to change this. So in executing our vision and seeking that change, we have identified 5 core principles based upon our research and scan to implement all this work through the center. We will operationalize equity, build trust, honor relationships, respect experts, and strive to shift culture. So family voice work requires operationalizing equity. It's not merely understanding that income, race, place, and privilege play an undeniable role in all of our efforts, but actually challenging racism and structural inequities by creating opportunities for diverse family voices that actively chip away at those attitudes, behaviors, and systems that have kept families from being true partners up to this point, and being true partners and leaders in their child's healthy development and learning. So thoughtful family voice work is action for equity, and we're seeking to unify families and policymakers by supporting policymakers in knowing and listening to our families. We will build trust. Trust is the currency of all of our work as advocates at Groundwork Ohio, and certainly was the most pervasive theme shared in all of our interviews with folks across the state and nation. We will earn and build trust with families and local stakeholders by making them feel valued, knowing they're heard, and ensuring that decisions will be influenced by their sharing or participation. We know that trust is dependent on relationships, of course, and we seek to honor those relationships, especially in recognition that it is community-based organizations that connect with families that we seek to serve and are most important to them. Families trust their community-based organizations, and so we want to partner and add value to the work of these organizations, many of whom I'm sure have joined us this morning, and not duplicate or undermine, certainly, these relationships. We will respect experts. This is just a simple and fundamental recognition that families and parents are the experts of their own lives and the lives of their children, regardless of education level, experience, or any other factor. Their lived experience is their expertise. And lastly, we seek to shift culture. So we've continued to hear and be inspired by the mantra, nothing for us without us, and we recognize that realizing it will not be easy and requires a culture shift and change of approach at all levels of leadership, from local communities to statewide policymakers, and certainly includes our own organization as well. So the objective of the Center for Family Voice is to build the capacity of parents and early childhood stakeholders to work together and engage at all levels along this continuum, this spectrum of family engagement image that you see in front of you. And also allow families to have an expanding impact on policy decisions and program development. So our goal essentially is to move farther to the right on that spectrum as we are solving issues in the early childhood systems in our state. You can see that parent participation begins with being involved, which is most commonly that a parent or their child is enrolled or receiving a service. This system has designed this service and implemented it through a series of policies and programs for these families, but ultimately the families haven't been participants in determining the service. And on the far right, at the other end of the spectrum, you see parents actually have decision-making power, and the system actually implements what they decide. The sole decision-making authority is with families. So we've, in our report, have shared examples of activities occurring in Ohio or across the nation that demonstrate these different levels of parent participation, of course, all of which have value in informing and influencing early childhood systems. But again, our goal is to continue pushing for that increased participation and increased influence of family voice on decision-making. In order to successfully carry out the Center's theory of change and ensure that, that families have that increased impact, the most important decisions the Center makes are not necessarily what activities it chooses to support, because there are many and many different formats to increase participation and the impact of families on decision-making, but how it does so. And how it does so is really guided by the principles that I discussed just a little bit earlier, And the Center for Family Voice is committed to utilizing the best practices gleaned from Ohio and national early childhood stakeholder experiences when engaging our families. Excuse me. We look forward to sharing more on these best practices, and they're really fully developed and shared in the report. They include eliminating barriers to participation for families, compensating parents for their time and expertise, communicating intentionally with families, ensuring there are established connections and robust support for family participation activities, investing in people first, exercising humility, and sustaining the rigor of effective family engagement, and lastly, measuring what matters and demonstrating impact with our work. So, given the Center for Family Voice's environmental scan research, including all the feedback from community stakeholders, Groundwork Ohio is really confident that the center has a place in our state, that we can add unique value and scaffold family engagement infrastructure across the state of Ohio to advance equitable outcomes for young children and families as a statewide public policy research and advocacy organization. And here is really a visual depiction of what you can expect from the center, all of the center's core capacities, all our inputs of what we want to bring and add value here in our state and to your work. So the first is we are committing to advocating for the recognition, resources, and accountability measures that integrate and support family engagement infrastructure into state policy. Family voice and engagement has to be embedded, and in fact, the most successful examples are embedded in state public policy, so in law. And public and private investments are made to ensure that family voice is included at tables where decisions are being made. The center will bring our systems level expertise and advocacy when evaluating how policy and investment can include and support family voices in policy development. The next is investing in strategic projects that strengthen local partnerships between stakeholders and families. And I hope that you hear the common theme for those of you community-based organizations on the line that we really want to bring opportunity and resource and shared problem solving to the work that you all are doing. And the center wants to bring those resources and expertise to public and private partners to evaluate and center family voice with the objective of improving policies and programs. And we really look forward to supporting those, supporting kind of direct or real-time impact of families, and also supporting the assets or the relationships that are built out of those projects beyond the scope of any one project to improve outcomes and eliminate disparities and share those learnings across the state. The next commitment is to develop and support a statewide family action network by working with local partners to create and disseminate information materials utilizing effective messaging that's specific to families. We heard a lot from our local partners that they don't always have the opportunity to engage in advocacy or policy work, but really want to create an opportunity for their families. And if Groundwork, kind of with their expertise and communications leadership, can provide the tools to disseminate this information and create opportunities, that it would be really appreciated among the state work that's already going on. And so we look forward to integrating our strong communication leadership and state policy and advocacy with families through those local partners and messengers so that policymakers and influence are more regularly hearing from family voices. The next commitment we're making is to build and sustain a family leadership fellowship of representative families across the state to build upon that local leadership capacity that's happening in communities and create a pipeline for families to engage more deeply in state policy development. We have some experience doing this in focusing on early childhood professionals. We've led, over the past couple years, 2 cohorts of early childhood professionals through our leadership fellowship. And so we want to bring this unique and build a unique curriculum to this new cohort of family members seeking to build leadership and advocacy skills each year. And we have learned that there is certainly a community of families across the state to draw upon that have had these experiences in local communities and would really be well positioned to take that next step and become a leader at the state level. Next is that we are committing to fostering the use of best practices, identifying ongoing learning opportunities, and providing a constant feedback loop for center partners. I think an interesting learning from some of the interviews is that there were others in the state who were seeking to learn and identify how they could add value in this space, really on the same timeline as groundwork. And they said, man, I really wish that this work had been completed prior to kind of my seeking out all this information, because it would have been really helpful as a starting point. So I hope this report is a starting point for some of you and for others across the state, but we want to be a resource ongoing to support the professional development of local and state partners who want to engage more deeply with families. And certainly we'll identify short and long-term tactics to support this learning, including peer learning communities and other collaborative communication efforts across the state. Our next commitment is to develop meaningful process and outcome metrics to measure impact and benchmark success for center activities. The process evaluation of activity and initiatives of the center will inform our strategies and expectations for our work in consideration of the theory of change that we've laid out. And we are seeking to measure the short and long-term outcomes among all of our activities using both numbers and feedback from stakeholders and other qualitative methods. So the center wants to commit to using and informing a Groundwork Ohio early childhood data dashboard that monitors key health and education access and outcome metrics for young children and families. So beyond those process metrics that we would set within our center, we also want to benchmark our success against whether we're making a difference in those long-term policy and outcomes for young children. So looking at key health and education access and outcome metrics for young children and families to identify opportunities and gaps in the work is also a commitment we're making. And that dashboard and certainly our internal process metrics will be reported publicly on the impact of the center, and hopefully can inform meaningful metrics for others. I think we heard a lot from those that we talked to that this work is hard to measure, and that is certainly true across our advocacy work when measuring impact, and so we'll continue to hone that skill over time. The next is we commit to employing leadership and staff at Groundwork Ohio that reflect a diverse set of skills and experiences to successfully implement the Center for Family Voice and deploy equitable principles shared in this report. So the internal governance of the center and the staff have to align with the external visions for the center's work. So we're going to strive to embed those principles and the center's work and learning and unique family relationships across the Groundwork enterprise when we consider staff, leadership, and advisory structures for the center. And the last commitment is to secure sustainable funding that provides consistency and flexibility. So this center is a long-term strategy. Building trust, relationships, shifting culture take time. And we have to constantly seek to sustain and build out diverse funding to implement all the center's work long-term. And we know that requires dedicated and flexible financial resources where others have been successful in doing this. So we look forward to doing that, and again, bringing more resources into the state and building awareness around the need to put investments behind this important work. So that is the conclusion of the commitments that the center is excited and thrilled to make for the state, for the community. We certainly, again, want to have you hold us accountable to our commitments. And I just invite you to explore our report, challenge what we've learned, really take a look at the best practices and the spectrum of family engagement, where there's a lot of details there that I think will bring to life through examples, real examples in Ohio and across the nation of how this could look, how a partnership could look between the center and a local community, and how you can begin to think about integrating this work on the ground here in Ohio. So next, I am most excited to introduce our panel of early childhood leaders who all have a unique and I think strong point of view on family voice and family engagement work, certainly from their own professional experience and leadership in our state. So I'm going to introduce them all together, and then we'll move into the panel. We are pleased to be joined by Director Maureen Corcoran. She's the director of our Ohio Department of Medicaid. Amy Cole, the president of Molina Healthcare of Ohio, and Dr. Sherry Killen-Stewart, who's the director of systems alignment and integration at the BUILD initiative. So a little bit about the structure of the panel. Each panelist will be asked 3 questions. The first question is the same for all panelists, and the second will have a different question for each, and then we'll return to the panelists all answering the same last question. We'll have a couple minutes to do so for each. I'm going to start and direct our first question first to Amy, and the question is for all of the panelists. As an early childhood systems leader, what's the value you place on engaging authentic family voice to transform policy in your current role and professional experience? So in consideration of some of those principles we identified as being foundational to the center's work, what principles perhaps resonated the most among operationalizing equity, building trust, honoring existing relationships, respecting parents as experts, and shifting culture? Amy, can you comment first?
Absolutely. Good morning, Lynanne. So first, thanks so much for the opportunity to be here today. I would like to take a moment to both congratulate and thank Shannon Jones, yourself, and the entire Groundworks team for the development of this insightful report. As I was reading it, I was reflecting on the early discussions we had with the Molina Care Support team when Shannon initially shared Groundworks' vision of the Center for Family Voice. And it's truly inspiring to see the extensive community input and sharing of best practices you have compiled for how the center can positively impact how we serve our families in Ohio. So as I think about the value of family voice, I think about the thousands of families we all serve and the importance of learning how to truly listen and respond to their needs in a meaningful way. I believe that through authentic family engagement models, we can find new and powerful ways to address inequities in maternal, infant, and child health, especially in Ohio communities that are experiencing the greatest disparities. And over the past 20 years, I've seen the value organizations place on family voice. However, I have found it's been primarily aligned to the first 4 steps of the continuum of family engagement that you outlined in the report. Each engagement is certainly very valuable, such as engaging with families in their child's health care plan or tracking data as to why members are calling, so we can have a committee design ways to improve processes and programs. However, I have seen it difficult to reach the last 2 steps, collaborate and empower, where individuals are active members of the decision-making process. And I can think of pockets of work that rise to this level. And that's why I get very excited about the vision and the goal of the Center for Family Voice that's committed to build this infrastructure and really help to transform the delivery of healthcare in Ohio. So as I think about the 5 principles, the one that really resonates with me is to build trust. As stated, trust is the foundation of any relationship. And as we all know, this is not quick or easy to do. And in Ohio, we are fortunate to have so many passionate and committed community and provider leaders. And building trust is what they spend years doing on the ground in their communities every day. And I think it will be a very important principle in thinking how an organization similar to Molina may engage in this work, and could see us learning from the best practice highlighted in the report from the Centers for Health Progress, where they were successful by building relationships with community leaders, who in turn built relationships with local community members. So I believe we'll have a real opportunity to learn a great deal from our local experts and how to best engage with families to begin to move this work forward in Ohio.
Thanks, Amy, and thanks for your kind words and obviously the opportunity to be able to do this work in the full, robust way that we had envisioned. So really appreciate your thoughtfulness in reviewing the report, and just really excited about the opportunities that are in our future. So I wonder if Dr. Killen-Stewart, can you respond as an early childhood systems leader? What's the value you place on engaging family voices to transform policy, and then some of those principles that may resonate in your experience the most?
Thank you so much, Lynanne, and thank you, Groundwork, for partnering with BUILD to really advance this valuable work of really listening to and understanding the strengths in communities. In our work at BUILD, we work with state leaders to support shifts in policy, practice, and program that are inclusive of and benefit marginalized children, families, and communities. speaking directly with families and community leaders really makes visible their strengths and their opportunities. But it also makes clear where policies and programs fall short of their intentions to support the well-being of young children and families. The principle that resonates most with me is really operationalizing equity, which requires that we go and we support others to go beyond our comfort zone and our natural networks, to really use data to decide who's in and who's out of programs, or which communities have opportunities for transportation, fresh fruits and vegetables, hospital services, early education and care, and those that don't. The key to operationalizing equity is to intentionally center those voices of those who aren't benefiting from healthcare or early education and care or employment. And it's key that we shift our policies, practices, and programs so that each child and family who has experienced long-term poverty, marginalization, or exclusion from programs, often we say hard to reach, are in fact included. These policies centered on those that are farthest from opportunity do benefit others. They have strong ripple effects when we tailor these programs and services to meet the specific needs of families. It's really a privilege to say we can't reach a population or we don't shift a policy or a program because we're used to doing it in a particular way. So we must intentionally work with people, programs, and structures that, as you said, have trust with the relationships. We must honor those existing relationships in community, but also support the capacity, size, scale, and staffing of those organizations. Often we think we need to bring in another organization or bring in another group to community, when in fact we've just made a decision not to build those organizations that are in those communities. So operationalizing equity, building trust, and really honoring existing relationships are all important to me.
Thank you so much, and I know our groundwork team learns from you every time that we get to hear from you. Director Corcoran, would you comment as an early childhood systems leader in Ohio, what's the value you place on engaging authentic family voice in your role and your professional experience, and then again, commenting on what some of the principles that may resonate with you the most?
Great. Well, thank you, Lynanne and Shannon. And it's also a pleasure to be here with Dr. Killen Stewart, and no surprise that Amy Cole, both personally as well as professionally on behalf of Molina, has provided such support and leadership here. She's a terrific partner for us in our work, and so I'm really honored to be here with both of you today. So as we've gone about our work in the last couple of years to try to look at what the next generation of managed care requirements should be for Ohio, it has started with a premise of the individual should be at the center of our focus rather than focusing on other things that are also important. So I would say, first of all, that the terminology, it's a little bit different terminology, but I liken our focus on the individual to what, Lynanne, you've characterized as honoring relationships. It is the heart of getting at anything about equity, is just to understand that every single individual has a story, has an experience that shapes their interaction with our healthcare system, shapes their community relationships, their friends and their family. And so starting with the individual has been a pretty important watchword for us in our work in recent years. The second that I really like, and I really want to emphasize for all of us, you said the word amplify, and I want to just, I guess, underscore why I think that is so important. Because, when you think about any one of us in the jobs that we're in, and by jobs, I mean, even if it's, a family with a number of children and demands, or it's a job outside the home or whatever it is, there is so much going on. There are so many demands being made on every one of us and families and communities. In some ways, it's not a surprise that the voices can't be heard. Now, we must do better about that, but I think that providing an opportunity and a vehicle to be able to amplify the voice and the story and bring that to a level platform with, as I think about it, particularly say in my position, to bring that voice and that experience to the same level of consideration as all the other kinds of stakeholders that I interact with in the course of a week, is the goal that we must, the standard that we must set for ourselves.
Thanks, Director Corcoran, and you're actually up next for this individual question. It's building on what you were sharing with us in terms of your leadership and being focused on family voice or the consumer voice. How are you hoping to implement and build on these commitments over the next couple of years or even longer term through your work at the Department of Medicaid?
Well, I guess let me start by saying that, you know, obviously, as you and as lots of those of you that have joined us today know, we've just finished the budget process. Some of us are still a little brain dead from it, so still recovering. But what is the best example, the best illustration that I can give is that over the last couple of months, really, there have been hundreds of families who have advocated for a component of our work called Ohio Rise, a specific specialty approach for children with significant complex behavioral health needs who are at risk of being removed from their families. And as I've talked with some of them over the last couple of days, I've said to them, and I would say here publicly, our ability to have been successful in the budget is to the credit of those family members. This is one tiny, relatively speaking, tiny component of the work. It is such an important component, and these families understood how the whole thing needed to fit together, but there had to be a specialty focus. And so it is really to their credit and the voices of families who were in every meeting, testified in every opportunity, wrote letters to everyone. I think we got a letter that had, I think, 500 families signatures that had gone to the president and the speaker and the governor. So that's the best example I can give. In terms of how we make it real going forward, there's I guess one or two examples I'd like to give. You know, that one of the benefits of COVID, one of the silver linings, as I call it, has been the work that we've been doing with Amy and our other managed care partners around the state. Because we couldn't do some things that we normally do because of the pandemic, plans came together collectively to focus on some key issues that were most acute because of the pandemic, and utilizing IHI, rapid cycle improvement, rapid cycle learning science, if you will. We started on this journey to try to make measurable improvements in key areas. And as we went along, I began to think of it as its collective impact. It's all the plans, the department, everyone sitting in the same boat, pulling on the oars, going in the exact same direction. So rather than each plan having their own project and the department being disconnected from it. It's everybody rowing in exactly the same direction. And so that has become a significant change in what we'll be undertaking in the future as we go forward. And the second part of that, or the second kind of the other side of that same coin, is that the new, the new expectations, the new contract that we've laid out is much more grounded in community and in encouraging and fostering the kinds of relationships that plans have had around the state in different ways for many years, but really creating or honoring the work that is essential there and is essential to the plans, as well as improving our overall healthcare system. So community-based, really community acknowledgement, along with a commitment to really collectively trying to impact some of the most difficult healthcare challenges that we face.
Thanks so much, Director Corcoran. The groundwork team is also recovering from the budget, of course, and that was really an incredible effort among parents around Ohio Rise, for which we were supportive. And we had similar real-time examples of just the kind of potential there is when families have a platform and the opportunity to be engaged in policy and advocacy at the state level. I'm going to move to Amy. Can you share how has Molina come to share this deep commitment to successfully engaging family and voice to improve care and outcomes for your consumers, but also this larger recognition of how you're contributing to care and outcomes for young children and families across the state, regardless of whether they're your consumers? So if you could comment on that and how you may believe that Groundwork Ohio, and more importantly, these local community-based organizations and relationships with them, can help overcome legitimate challenges that health systems have engaging families.
Absolutely, thank you. And it's just really fantastic to be on this panel with Director Corcoran and listening to what her vision is of this new reimagined Medicaid program, because Molina's really proud to be, a part of that and having the privilege to serve over 350,000 Ohioans every day. And in this work, we're not only committed, but we are accountable to provide every family access to the same quality healthcare, regardless of their race, their income, or where they live. And to support these families to really be their best, we believe that we need new and different solutions to advance equity. And over the years, Molina's families have expressed concerns. Some of those concerns have been about the lack of trust in the healthcare system or limited social supports and community resources that they think are important to their family. So Molina has really taken this feedback to heart, and through the financial support of our foundation, which I'm so grateful for, coupled with the deep support of our senior leadership team, Molina has made a commitment where we really want to seek to identify and listen to authentic family voices. We want to place our families in the driver's seat and create opportunities for them to make the decisions on how they prefer to receive their health care. So to do this, we need lots of partners, and we're so excited to work with Groundwork, who's not only a trusted statewide public policy, research, and advocacy organization, but a skilled convener of partners across the state to implement the Center for Family Voice. So in reviewing the report, I was really struck by the principle of respecting experts. And I think this kind of goes to what the director was commenting on about the importance of the individual. And it just reminds us that our families represent a team of experts that we have not really fully embraced. I think there's lots of great examples. Ohio Rise is a fantastic example of that. But I do think that leveraging this new infrastructure, working closely with Groundwork and the Ohio community-based organizations and providers, there will be an opportunity to collaborate on family engagement models that will let us learn and impact public policy and help organizations such as Molina and others customize our maternal and child health programs. And I thought it might be helpful just to share with the group some of the ideas that we thought about, right, as we've been brainstorming the value of this model. I think it could be things as simple as addressing health literacy, developing culturally appropriate nutrition solutions, or it could be more extensive, such as leveraging community health workers to gather information on what will help a woman enroll and stay engaged in home visiting programs. The opportunities are really endless, and what I believe will be keenly different through the center is it will be family driven, it will be collaborative with lots of stakeholder engagement that's building an infrastructure to learn from these family experts and truly understand their unique experiences, use those learnings to inform public policy, and ultimately transform how we all work together to deliver healthcare.
Thanks, Amy. And then I'm going to move to you, Dr. Killen-Stewart. From a national perspective, and given your experience in Ohio advising the Department of Health and their work focused on eliminating disparities in infant mortality, where have you witnessed strong state and community partnerships that authentically engage families to advance equitable outcomes for young children and families? Or what may be the opportunity or special ingredients that allow Ohio to be able to lead in this space?
Yeah, thank you, Lynn. Bill works with supporting states to build early childhood systems. And Ohio is already demonstrating, has been a long-term partner with Bill in demonstrating some of those key characteristics. We talk about equity. We want to increase opportunities, as Amy just mentioned. We want to remove barriers, as she described in her example around home visiting. We want to distribute resources in ways that really get to children and families that are marginalized. And we want to monitor to really make sure we're getting the impact, which you mentioned in the report. So when I think about Ohio, I think about influence, partnering, cross-sector, data, commitment to ongoing relationships, and documentation. In the area of influence, the Department of Health may be the lead, but you have the strong support of the governor's office and really trying to take on some of these challenges. And his staff is readily available and showing up frequently to really support the Department of Health to lead in this space. Across sector, many agencies have been brought together. Equity is not just about health. While health is important, it's also about education and housing and transportation. And Ohio has put together a cross-sector table of leaders, recognizing that there is not one solution when we say we really want to listen to families. When we go to families, they're not going to start with health necessarily. They may start with housing. They may start with health, but need transportation. And of course, employment is linked, and care for their young children, as we've learned in interviewing families with you across the state. Partnering was key, and they're demonstrating that factor, that while they're at the state, they don't actually touch the families. And so, as you've described in your report, and as the Department of Health has supported with their resources and time, we have to have relationships with organizations that are on the ground, but not in a one-time way. We have to create a feedback loop with them so that they know what's going on. And groundwork's been key in having that role. We need to use data to decide who to listen to. And the department really demonstrated that in our work around eliminating Black infant mortality. It started with the 11 communities where the data demonstrated had the highest needs. That helps us really lean in and reach our goals around equity. They're committed. It wasn't about a one-time relationship. You as state leaders, you say, oh, I listen, but I can't do everything about what I hear. And now you want me to go back and tell them what I heard, but they stayed at the table and they're committed to ongoing relationships. And I think this center is really a chance to keep that ongoing relationship going with families, with organizations, and with the states. And then finally, they've taken on the idea of quotes, not notes, that we don't want to use our own bias in writing notes about what we hear from families. We actually want to take the quotes of what families say so that we can spread it and share it with other groups, and others can take action and have their own interpretation. So that's just the beginning, but you have a strong partner in the state.
Thanks so much, Dr. Killen-Stewart. And the quotes, not notes mantra has rapid fire among our team. We say it daily now, so I hope that sticks with everyone on the line today. The last question for everyone, same question, and I'm going to start with you, Dr. Killen-Stewart, and I'll go to Director Corcoran and then end with Amy. What are you most excited to see in 3 to 5 years from now when it comes to this? You had your magic wand and you consider what the potential of the Center for Family Voice work could be. And then secondly, as we invite continued learning and feedback to achieve this shared vision, what would be your call to action for state and systems leaders and community-based organizations who are critical to making this work successful?
Yeah, thank you. I'd really like to see an increase in opportunities for communities that right now we would label as not having low opportunities. And for me, this is not necessarily about new money. I feel you're paying from the budget as a previous commissioner, but it is about the services that should be available to them now. So how are we repositioning program services and initiatives to better meet the needs of the children and families that we're talking to? This is our real measure of success. It's not, our intentions are noble, but an impact is essential in the reduction of infant mortality, an increase in living wages, access to employment, fruits and vegetables, transportation, quality health care built on trust. I'd also like to see community leaders and families, not just in the initial conversations and the advocacy, but also in the design, the implementation and monitoring, because here's where you'll get the continuous improvement. And we need families to feel safe in the process of receiving service to be able to say, this really isn't working for me, versus backing away or being pushed away and leaving. And finally, I'd really like to leave you with the idea that you need to invest in the small organizations in the communities, that the people you try to partner with won't have access to Amy, won't have access to Director Corcoran. You will be the bridge. And often we rush in with another organization, and we really do have to build the capacity of the organizations that do have the relationship with the community. And we need to be consistent and do that over time.
Thanks so much. Director Corcoran, do you want to comment?
Yeah, and I do love the quotes, not notes. That's spectacular. I want to, I guess, pick up on something that Sherry said about kind of relates to data and opportunity. As we looked at the data, this is specifically about vaccinations, but it, is a similar pattern. As we looked at the data of vaccinations in Ohio and sorted it using the Ohio Opportunity Index, we found that people on Medicaid, individuals on Medicaid, were being vaccinated at about half the rate that the rest of the Ohio population was. But when we broke it out into opportunity indices, we found that within those served on Medicaid, that those who were in the lowest opportunity communities were being vaccinated at a quarter or a half of what the Medicaid population as a whole, which was again only half what the entire population is. So you triggered it for me, Sherry, and I want to just sort of underscore, there's nothing like being able to break it down by the data, and then as we're working with the plans, we've tied that very specifically to our common or shared goal that we're going to have a certain degree of improvement in those lowest opportunity communities. So just I guess sort of an anecdote. What I'd like to see in the future, or what I would consider to be helpful and successful in the next couple of years is, number one, Lynn-Ann, and I know you and Shannon will do this anyway, but I would ask or offer or challenge Groundworks to hold us all accountable to this and to come to us. I've said to you today, our commitment is to put the individual at the center. I want you to come to us frequently and say, show me how the input from families directly is connecting to changes you are making. And just keep reminding us of the importance of that. And I want to end with one of the most mundane minutia aspects to this whole thing. But this is one of those, the devil's in the details. In all the work that I've done with families or other kinds of advocates or stakeholders over the years, it is the little things that really do make it difficult for individuals to participate. How do we get them money to be able to take the bus to come to a meeting where you're getting input on system changes or whatever it is. So helping us figure out, what are the kinds of very practical things that have to be provided in order for people to be able to participate and to be able to sustain that participation, and help us, if necessary, to create those sort of extra governmental ways of supporting that, because you know that doing this sort of thing within any of our big organizations, whether it's Amy's or ours as a governmental agency, can be very difficult. But we have to be willing to support people, to pay them, or to pay for their expenses, and they can't wait 2 months to get money back from an invoice. So help us with some of those very practical kinds of things that get in the way of people being able to participate.
Well, thank you, Director Corcoran. I feel confident we can make good on your first request. And on the second, I think I may have shared with you before, but we've been testing that out with the Department of Health, and Groundwork's been providing some support and putting our best practices to the test around compensating families. So we look forward to doing that more and more. Amy, I'm going to end with you, just your most excited to see in the next several years, and any call to action for those who are listening.
Absolutely. Well, thank you, Lynanne. Knowing the collaborative spirit of our Ohio community-based organizations, our healthcare community, and really all those family-serving stakeholders, what I'm really excited to see is the adoption of the centering of family voice being deployed in some strategic projects that we can really test that theory of change. And as Dr. Killen Stewart said, and the director both, I think it'll be really important to get those process and outcome measures established, because we really want to be able to see, the improvement that we're making over time. And that's going to help with sustainability and getting those financial investments that we need to continue moving this work forward. So as far as call to action, I just hope that all of us will be champions. This is a really bold effort. It's going to take all of us working together where we can really lift up our families, help them with some professional development and training, right? To give them the confidence to feel that they are prepared to engage in these types of discussions. And then those things that the director was speaking of, right? Just the barriers to getting them engaged, got to be working together to absolutely address those. And I am hopeful that we'll see our families, the team of experts, just become common, that they're at the table and helping us to make decisions around healthcare and policy here in Ohio. So thanks again for the great work on getting us started with this report.
Well, thank you so much, Amy, and thank you to all of our panelists today. We're certainly inspired and energized. Even coming off the state budget, I think we are really energized about how this work is moving forward and the commitments of all of our stakeholders and the folks that we've talked to. You'll see from some of the quotes in the report, there wasn't one that said, this isn't really a good idea. I don't really think this is the wrong the wrong path. And so we're really looking forward to everyone coming together. We know there's great power in potential and supporting families, and we look forward to being a partner to our state leaders, but most importantly to the folks that joined us this morning and others who we've never met before in terms of those folks who are on the ground working in local communities. So thanks again to all of our panelists. Just my call to action and Groundwork's call to action for those who are listening is that we are just hopeful that in reviewing this report, you see yourself. You see your work, you see your organization's mission echoed in the values, you see a place for your families, and that the objectives and the activities of the center could be of value to you. So please know that if you do, that you have a seat at our table as a partner in the work for the Center for Family Voice, and know that the work will only be as strong and connected as the diverse network of relationships it supports across the state. And I love this quote that I'll leave you with from one of the interviews we did, which is, if we can listen and genuinely engage, there's an army out there to be motivated. And I know Director Corcoran and I both commented on just in the past few months, the army of parents and families who are demanding that their voice be heard. And we hope to support that in the coming years long term so that it does become the norm, as Amy said. So please accept this report as an open invitation to plug in, and with us, we invite your feedback on the report. Expect that you'll keep us accountable to our commitments and help us keep our state leaders accountable as we turn up the volume on Family Voice. Please feel free to contact the Groundwork Ohio team with questions, comments, and feedback. We want to get to know you and your story, and we've created a form for you to do that on our website at www.groundworkohio.org/familyvoice. So please, I've seen some messages come through the chat box. I'm really encouraged. Connect with us so that we can continue to share and learn from you. Thanks so much for your time this morning, and have a great day.